Hi everyone, welcome to this week's episode on Nutri-Med Online Clinic. My name as usual is Professor Henry C. Urochukwu, a physician, medical biochemist, a clinical nutritionist, and a certified food scientist. We're going to look at what bothers a lot of the young people and even elderly people. Sometimes you feel bored, you are fearful, you feel lonely, you feel like you're sad. And the only thing that comes to your mind, not because you're hungry, is to go out there to look for something to take. Most times it's like a bite, some other times it's like a drink. Going for soda, for instance, from the fridge. Do we understand what it is? This is what is called emotional eating. And in some people, in very many cases, it usually leads to a more medical condition that is called binge eating disorder. This is where we are taking you through this week. We know a lot of young people in their primes are used to this. Either eating late in the night, going for shawarma, going for ice cream, going for high sugar, high calorie, fatty foods, high salt diet. Does these things have effect on our body? We've been able to look through to find out that this is actually dangerous. Emotional eating is a problem, it's a behavioral problem. Most times we see that we are tired from work or from wherever we are coming from. We feel sad, we feel lonely, we feel rejected, we feel disgusted. In any of these, sometimes we can be very happy, feel loved. There are ways, regulatory and inhibitory forms that the higher centers of the brain try to make us react to situations. Now, so many people react to this differently. Now, one of the commonest things we have noticed among young people and of course middle-aged people is that instead of looking at things that will make them overcome such situations, they fall back to food and drinks, even when they are not hungry. And whenever food is now disinhibited, the intake is disinhibited, such that people now want to crave for food. Usually, particularly high carbohydrate food, high fat food, food containing too much salt. They are there in the fridge, they are there around the parlor, the sitting room. They are just everywhere around. There can be cake, there can be white bread, it can be soda drinks, there can be shawarma or ice cream. Whatever it is that at the moment of emotions, the moment of fear, the moment of loneliness, you now want to go for. Such situations, not because one is hungry, such situations is what we term emotional eating. So in emotional eating, people eat because they want to overcome a situation. They are not eating because they are hungry. And some other times, when this kind of behavioral pattern is not challenged, you will now find out that such people graduate to what we call binge eating disorder. The only difference that binge eating disorder is actually a more advanced health issue. Because in binge eating, one eats way bigger and larger portions of food than the average person will normally take. And when such eating habits occurs once a week for at least 3 months, then we diagnose such situations as binge eating disorder. Now, in binge eating disorder, there is a neuronal, that is a higher center dysfunction, because that regulatory processes are no more there. So the person goes on and on again, instead of eating responsibly, instead of mindful eating, where you take your time, take small portions of food, eat right, eat in bits, slowly eat, slowly chew, thoroughly chew, And then of course, let the senses of the body respond to what you're eating. No, such ones are mindful eating. The moment you are not taking it this way, taking the right portion, biting small, savoring the food, not in a haste, then it becomes binge eating. Now, binge eating is a big problem, but emotional eating will, in most cases, lead to binge eating disorder. So what we are trying to prevent is binge eating. Because if we have to stop emotional eating, then we can stop at the binge eating. Take for instance, a woman or a man comes back home and late in the night he wants to crave for maybe a swallow and a goosey soup. Or is it the cake in the fridge and the soda drink? Or is it the white bread? Or is it the shawarma in the fridge? Or it can be pizza. It can even be chips, potato chips. In any of these, it becomes a habit that when once the person feels lonely, you go for such food. Now the major problem with this is that such individuals are prone to what? Overweight. And of course, obesity. And the problems of overweight and obesity are very, very numerous. Because even at any particular age in time, nobody wants to have or hear about diabetes mellitus. Nobody wants to hear about, high levels of fat in the body, hypercholesterolemia. Nobody wants to hear and see a situation where you have cardiovascular problems as a result of your eating habit. So this is why we are worried, because people, especially at adolescent age, we rather want to sit in the sitting room, watch television, and the next moment they are chewing nuts. The next moment they are eating chips. The next moment they are licking ice cream. The next moment they are taking shawarma. All of this constitutes emotional eating. Not because they are hungry, but because they crave for these common foods that are easily available and around them. And when once you don't put a stop to emotional eating, like we have said, it will always lead to binge eating disorder. And the problems, the health conditions are very numerous. How can we do this? How can we come out of this? Yes, you see, coming to the field, there's a very particular traditional association between happy moments and bitter and sad moments. Usually happy moments or good emotions are usually linked to sweet food, while bitter moments are linked to bitter taste foods. Now, you see that most times when people are happy, of course, we associate cake, food with ceremonies. And the same way people associate bitter situations, some people will prefer to take alcohol or take, whatever type of alcohol they want to take, or beer or thereabouts. And then some people may also want to indulge in every other thing that will make them happy. So this is traditional, but we have also noticed the trend of relying on things like potato chips and all that, or shawarmas as we mentioned, or cake, or white bread and all that, or going just straight for soda with biscuits. So any of those things is what we are talking about. Certainly it's not right for us. We must eat food as though we are taking medicine, because that means you must take those quantities that are prescribed to help you live healthy. And now, if this is the situation, can we have a way around it? Yes, we can. What we think and what we know is that the moment you feel lonely, pick up a phone and call a friend. Hello, how are you? You do a good chat. Check up on your friends. You can also take a walk. Take a walk from your room, walk around, get the fresh air, look around the environment. That one, you are achieving a lot. You are reducing binge or emotional eating. You are also exercising your muscles. You can also do quite other things. If you like pets, go for your pets. I like dogs. I have a lot of dogs in my house. I like cats. So most times I call my cat, I call them good names, and they are excited when I call them. And you can see even fowl, even local fowls. Of course, I have my cows, and sometimes I look at them and I feel happy because when I call them, they know I am bringing something forth. So you can get yourself engrossed in things around you. That is why God is important. God is so important on His side. All these things are created to make sure you have varieties around you. And so when next you are sad, when next you have fearful situations, when next you feel rejected, when next you feel disgusted, do not stomach it. Do not go back to your shell. Move out there, call, make a call, play your games, talk to your pets, play with them, interact with your environment. Take a walk around, and that could be better. We want to believe that if you stop craving for food, you will live healthy. Why, by the way, do you know that the brain is made up of some 60% fats? Do you know that the brain has things that will make it to function well? Are we aware that when you deny yourself of certain food substances, the brain that controls so many of your activities in the body will suffer? And the brain synthesizes some major compounds and hormones, chemicals that also help the body. And so in trying to achieve this, the hormone need some of these macro and micronutrients. The ones you take in big quantities, the ones that are in small quantities but that are very, very important to your body. One of them is the building block of proteins, which is called amino acids. Some of them are called cofactors, which are manufactured from things like vitamin B and of course things like folate. Now, in some of these things, the hormone releases chemicals, the brain releases chemicals, and the chemicals the brain releases helps the brain to coordinate the body system. So, you will follow us next week. We are going to look at which of these macronutrients, which of these micronutrients will help you have a better mental health. Because when those things are not there, the brain gets ill. Mental illness commonly manifests as depression. Mental illness increases your stress level. So trying to stay away from stress, trying to reduce your stress, we will talk about it in the coming weeks. Follow us on Nutri-Med online clinic. Again, I'm your host, Professor Henry C. Roche. Thank you for this week's episode.